Good morning and Happy New Year sa ating lahat. I hope you have enjoyed your vacation. So we will start our RLE, Virtual RLE on management of structural, infectious, and inflammatory cardiac disorders. So I hope you have finished your pre-test. Yung pre-test na yon ay check natin kung how much ang nalalaman ninyo regarding this aspect of cardiac disorders. So these disorders present many challenges for the patient, for the family, and the healthcare team. Wala pa ako so far na-encounter na major heart surgery dito sa Nueva Vizcaya. Siguro may meron na. We have cardiologists, we have Dr. Constantino, but I have not encountered so far heart surgery, open heart surgery, or closed. So problems with the heart valves, cardiomyopathies, and infectious diseases of the heart after cardiac output, alter cardiac output. So yung mga problem natin sa heart valves, cardiomyopathy, and infectious diseases, naapektuhan niya kung how much ang cardiac output or yung kayang ipump ng puso at one heartbeat. So when we talk about valves, we talk about the atrioventricular valves, we talk about the tricuspid valves, and the mitral valves. Ang cardiomyopathy naman, from the word cardio is heart and myo is muscles. Ibig sabihin, this talks about the disorders of the heart muscles. And the infectious diseases naman, naaapektuhan niya rin ang cardiac output natin. Their treatments or the treatments of these disorders may be either non-invasive katulad ng gamot or mga diet modifications, activity modifications, or it can be invasive such as different types of operation, merong valvuloplasty or transplantation. Either way, nurses have an essential role in the care of the patients. Do not forget that when you have a patient with cardiac disorders, be very careful kung hindi pa kayo sure kung pwede silang mag-CR mag-isa. Hanggat hindi pa kayo sure kung ano ang kanilang diagnosis, you might as well assist them assist them when they go to the bathroom or hanggat maaari mag-provide kayo ng bedpan para umihi na lang sila sa kanilang stretcher o kaya sa kanilang hospital bed. You don't really know yung mga tinatakbo, lalong-lalo na sa ER, may mga tinatakbo, you don't know is naka heart attack na pala sila. So, when you encounter cardiac disorder patients, be very sure kung pwede silang mag-CR mag-isa before allowing them to go to the bathroom alone. So we go to the learning objectives. On completion of the 2 days virtual RLE, the learners will be able to define the valvular disorders of the heart, describe the cardiac valve repair and replacement, describe cardiomyopathies, infections of the heart, and pericarditis. Don't forget when we talk about a word with itis at the end of the word, pericarditis, folliculitis, appendicitis, yung mga words na may mga itis sa dulo, ibig sabihin inflammation. Halimbawa, appendicitis, from the word appendicitis is appendix and itis. Ibig sabihin, inflammation of the appendix. Kapag sinabi namang tonsillitis, we talk about the inflammation of the tonsils. So, walang sakit. Halimbawa, kapag sinasabi nilang may tonsil ako, may appendix ako, totoong may appendix at tonsils ang tao, pero ang tawag dun sa sakit nila ay tonsillitis or appendicitis. Itis means inflammation, so don't forget that. So, according to Brunner and Sudart sa medical surgical book niya, the valves of the heart control the blood flow of blood. So, we have here a picture of the heart. Ang valve na tinutukoy natin, where is the pointer? Ang valve na tinutukoy natin is this one and these ones. So don't forget, kapag right atrium or between right atrium and right ventricle ay tricuspid valves, at kapag gitna ng left atrium at left ventricle ay mitral valves. And yung gitna ng aorta and the left ventricle ay aortic valve, and yung gitna ng right ventricle at pulmonary artery ay pulmonary valve. So kapag mga pulmonary artery, ito yung nanggagaling sa puso papunta sa lungs. Galing sa puso papunta sa lungs. Ito lang yung artery na kulay blue sa mga pictures. Kung napapansin niyo sa medical surgical, mga books about the heart, ang artery lang na kulay blue ay pulmonary artery. Bakit? Dahil ito ay nagko-contain ng blood sa lungs lang ang kanyang circulation. So, magmumula sa lungs, babalik sa heart. Magmumula sa lungs, babalik sa heart through the pulmonary veins. And then from the pulmonary veins, pupunta siya sa left ventricle. And the left ventricle will be the area to pump blood through the aorta and towards the rest of your body. So, don't forget, the largest blood vessel is aorta. Bakit? Dahil dito, pinapump ni left ventricle ang napakaraming dugo at ang susuplayan niya ay buong katawan. So, no wonder na ito pala ang pinakamalaking blood vessel dahil napakalaki ng kanyang function, pang buong katawan na yung artery na ito. Diba napakaraming arteries? Coronary artery, femoral artery, pero pinakakakaiba ang aorta dahil dito sila nagmumula lahat. So, yung aorta ang pinakamalaking artery. So, don't forget that. Ang inferior vena cava, so, when the aorta carries blood to the body, magsisirculate yan, and then papalitan sila ng dugo, ng unoxygenated blood, versus oxygenated blood, magpapalit yan sa mga capillaries. So, ang ibabalik na ng katawan papunta sa puso ay unoxygenated blood. The aorta will bring oxygenated blood towards the body, and the body will return unoxygenated blood towards the heart. Kapag manggagaling sa baba, inferior vena cava. Inferior vena cava, dadaan ang mga unoxygenated blood from the lower part of the body, and then the superior vena cava will bring unoxygenated blood from the upper part of the body. Huwag kayo malilito. Just refer to these words. Kapag sinabing superior, are you familiar with your anatomical terms? Kapag superior, nasa taas. Kapag inferior, nasa baba. So, when unoxygenated blood comes from the lower part of the body towards the heart, it goes through the inferior vena cava. And when unoxygenated blood comes from the upper part of the body towards the heart, it goes through the superior vena cava. So, pag nanggaling dun sa superior vena cava, dadaan dun sa kanyang right atrium, and then bababa sa right ventricle through the tricuspid valves. Don't forget, galing sa superior vena cava and inferior vena cava, darating ang blood sa right atrium and bababa sa right ventricle through the tricuspid valves, and then ipapump ito ng ventricles towards the lungs for oxygenation. So, unoxygenated siya, dinala siya ng katawan sa right atrium, ipinump ng right ventricle towards the lungs for oxygenation. So, kapag na-oxygenate na yung mga blood na dinala doon sa lungs, babalik siya sa heart through the pulmonary veins. Ito. So, pulmonary veins carry oxygenated blood from the lungs towards the left atrium, and then pababa siya to the left ventricle via mitral valve. So, makikita ninyo ang pagkakaiba ng right atrium ay tricuspid valve at mitral valve. Sinabi, pag tricuspid, ibig sabihin tatlong valve yan. 1, 2, and 3. Mitral valve is 2. 1, 2. So, don't forget, kapag right part of the heart is tricuspid valve, and then kapag left part of the heart is mitral valve. Tricuspid is tatlong valve, mitral is dalawang valve. So, kapag dinala ng vena cava to the right atrium, bababa sa right ventricle, dadaan siya sa tricuspid valve. And then, kapag dadalhin ng right ventricle towards the lungs, dadaan siya ng pulmonary valve dahil ang artery na pinupuntahan ng blood from the right atrium is the pulmonary artery. Thus, ang pangalan ng valve na ito ay pulmonary valves. And then, pag nanggaling sa lungs, babalik siya sa left atrium. And then, from the left atrium, dadaan siya sa mitral valve, pupunta sa left ventricle. And then, from the left ventricle, ipapump ng heart ang blood towards the aorta. And then, the aorta will deliver the oxygenated blood towards the rest of the body. So, kapag manggagaling ng left ventricle papunta sa aorta, meron ding valve dyan na tinutukoy nating aortic valve. Aortic dahil pupunta yung blood sa aorta, kaya aortic valve. Kapag pupunta ang blood sa pulmonary artery, magkakaroon tayo ng pulmonary valve. So, don't forget the function of the valves. Kapag dadaan kapag mag-o-open ng blood, kapag mag-open ng valve, dadaan ang blood. And then, kapag nagko-close ang valve, walang dadaan na blood. So, merong sakit na tinutukoy nating regurgitation, kung saan yung valve hindi siya masyadong nagko-close, kaya yung mga dumaan na dugo babalik sa valve. So, by the way, these pictures came from Britannica.Incorporated. So, atrioventricular valves separate the atria from the ventricles. So, ang ating AV valves ay tricuspid valves and the mitral valve. Ang ibang pangalan pala ng mitral valve ay bicuspid. Bicuspid. 2. Kapag tricuspid, 3 valves. Bicuspid or mitral valve ay 2 valves. So, makikita ninyo ang difference ng mga valves kapag nagse-separate ang valve ng atrium at ventricle. Ito ay atrioventricular valves. Kapag nagse-separate ang valves ng ventricle to the aorta, aortic valve. Kapag nagse-separate ang valve ng ventricle at pulmonary artery ay pulmonary valve. So, ang function ng valve, kapag nag-open ang valve, dadaan ang dugo. Kapag nag-close ang valve, hindi na dadaan ang dugo. So, sa bawat pitik ng puso, mayroong cycle yan. The heart relaxation and the heart contraction. So, when the heart contracts, the valves will close, and then when the heart relaxes, the valves will open, allowing the blood to flow through. So, semilunar valves naman yung nagse-separate ng ventricles to the arteries. Kapag ang artery pupuntahan ay pulmonary artery, pulmonary valve. Kapag pupunta siya sa aorta, aortic valve. Huwag kayong malilito dyan. So, I'm talking about the regurgitation a while ago. So, Blood flows through the valve when it opens. However, it flows back to the heart, or it flows back to the source of the blood when the valves don't close properly. So, when any of the heart valves do not close or open properly, blood flow will be affected. And when the valves don't close completely, blood flows backward through the valve, which is a condition called regurgitation, brought by the force of the blood pressure with each cycle of the heartbeat. The valves will have to be firm to direct the blood flow within the heart. Kapag hindi masyadong makapag-close ang valves, leaving an opening, pwedeng bumalik yung dugo na lumusot dun sa valve, which is called regurgitation. Stenosis naman yung tinatawag ang pangtawag dun sa condition kung saan yung valve hindi masyadong nagko-close. Kokanti lang ang masusupply na dugo kapag hindi masyadong nagko-close ang valves dahil imbes na dumaan yung maraming dugo, hindi siya masyadong nag-close kaya may mga bumabalik na dugo through the valve. Kaya konti lang yung nakakalusot na dugo. So, ang function ng valve ay mag-open at mag-close. Kapag nag-open siya, lulusot ang maraming dugo. Kapag nag-close siya, makokontrol ang blood flow. However, kapag hindi masyadong nagko-close or merong opening sa valve ay yung mga lumusot na dugo, babalik siya doon sa source niya. Thus, magkakaroon ng low blood flow or bababa yung blood flow. Ang regurgitation at stenosis, ito ay pwedeng umapekto sa lahat ng heart valves. It can affect the atrioventricular valves or the semilunar valves. By the way, tinatawag natin siyang semilunar dahil lunar means moon, di ba? Kapag sinabing semi, para siyang kalahating buwan. Para siyang half moon, parang ganun, oh. Kaya tinatawag siyang semilunar, which is very different to the atrioventricular valves. Para siyang stick na mahaba. Pero kapag para siyang kalahati ng buwan, semilunar. Depende kung gaano kalala yung mga regurgitation and stenosis. Marami sa mga valve disorders, pwedeng hindi na kailangan ng treatment. Pwedeng yung iba, kailangan lang palitan yung kanilang lifestyle. Yung iba, kailangan lang uminom ng konting gamot or certain medications. Pero yung mga ibang regurgitation and stenosis, kailangan ng surgical intervention. It's either i-repair nila yung valve or papalitan na lang nila yung heart valves. So, let's go to your activity. This activity will be 30 points. So, complete the table by filling up the missing informations pertaining to the different valvular disorders. So, we have identified 4 valvular disorders including mitral valve prolapse, mitral stenosis. Ibig sabihin ng stenosis, di ba? Hindi masyadong nagko-close yung valve and we are talking about that mitral valve. So, mitral stenosis is when the condition is hindi masyadong nagko-close ang mitral valve. The atrial regurgitation, kung saan bumabalik yung dugo through the valves of the atria. And then the aortic stenosis, hindi masyadong nagko-close yung aortic valve. So, I hope you have that idea. Kapag stenosis, hindi masyadong nagko-close. Kapag regurgitation, bumabalik yung dugo. So, in these activities, you have to find out the difference between these four disorders. Kung ano yung pagkakaiba nila sa kanilang clinical manifestation sa assessment. Sa assessment, kung ano yung mga diagnostic test na pinapagawa. Nagpapagawa ba ng trop-I? Nagpapagawa ba ng 2D echo? Chest x-ray? Etc. And then, what are the medical management differences between these 4 disorders? And then, how can we prevent these disorders. Kung ano yung pagkakaiba ng mga disorders na ito through these different aspects in the symptoms, assessment, and then the medical management. So, 30 points ito. If you can pass before 3 p.m. today, you will be added 20 points. If you can pass before 11 p.m. today, you can be added 10 points. So, ang total nito ay 50 points. On to activity number 3. Research and write on the different surgical management of valvular disorders. So, merong dalawang uri ng surgical management. Merong dalawang uri yan. It's either repair or replace. So, merong dalawang uri ng surgical management ng valvular disorders. It's either to repair or to replace. So, i-identify ninyo kung ano ang valvuloplasty, kung ano itong mga to, annuloplasty, repair, and chordoplasty. Don't forget, kapag ang salita ay merong plasty sa dulo, ibig sabihin ay repair. So, kapag sinabing valvuloplasty, it is the repair of the valves. Kapag sinabing chordoplasty, repair of the i-find out niyo kung ano itong medical term na yan. And then, annuloplasty, repair of the what? Medical term. Basta kung merong plasty sa dulo, merong repair of something. And then, in managing valvular disorders, we have also surgical management wherein we replace the valves. So, ano yung mga ito? Anong ibig sabihin kapag sinasabi nating mechanical valves? Anong ibig sabihin kapag sinabing tissue valves? And then, grafts. Ito yung source. Ito yung source ng i-replace natin sa valves. Alin dyan ang tumutukoy kapag ang source ng i-replace natin sa valve ay galing sa human tissue? And then, ano naman dyan yung nanggagaling sa animal tissue? So, in replacing the valves, pwede tayong gumamit ng mechanical valves, tissue valves, pwede tayong gumamit ng nanggaling sa tao, pwede tayong gumamit ng nanggaling sa animals. So, if you can pass this before 3 p.m., plus 20 points. If you can pass this before 11 p.m., plus 10 points. By the way, minus 5 points kapag not following instructions. Handwritten po ito. Handwritten, yung box, yung paggawa ng table, isusulat ninyo sa yellow pad paper o kaya coupon band kung anong available na paper sa inyo. I hope na kahit na online tayo, hindi pa rin ninyo nakakalimutang magsulat. When you are nurses, magsasawa kayo magsulat dahil what you have not written is not done. So, nurses have to write a lot and they have to read a lot. So, this activity will be handwritten. So, plus 20 kapag nag-pass kayo bago ang 3 p.m., plus 10 kapag bago 11 p.m., and minus 5 points kapag hindi handwritten. That is all for this PowerPoint, and thank you.